Welcome back for another deep dive. Today we're diving into Adapha.
Adapha,
Yeah.
a Turkish company, making some pretty bold claims about AI in healthcare.
Yeah, and they're not just talking about, using AI in healthcare generally.
Right.
They're claiming to have developed the world's first AI-powered application for preliminary diagnosis
Preliminary diagnosis
of cerebral palsy.
in infants.
Wow, that's a huge statement.
Yeah.
Especially in a country like Turkey, where 10% of babies are considered high risk for cerebral palsy.
It's definitely worth exploring.
So for this deep dive, we have their website, their LinkedIn profile, and a briefing document that outlines their key claims.
Okay.
Let's start with the basics. What exactly is Adapha, and where do they fit into the healthcare landscape?
Well, Adapha is a startup
Okay.
founded in 2020
Right.
based in Samsun, Turkey.
Alright.
Yeah.
Got it.
They're a relatively small, privately held company,
Okay.
but they've already attracted some serious attention.
What kind of attention?
Well, they've secured angel investment.
Angel investment.
Yeah, which means someone believes in their potential enough to put their money behind it, and they're working with TÜBİTAK,
Okay.
the Turkish Scientific and Technological Research Council,
Yeah.
which suggests that their work has some legitimate scientific backing.
Interesting. So they're small but ambitious with some powerful connections.
It seems so.
So who are the people behind this?
The founder and CEO is Dr. Sima Agul.
Okay.
Her background is quite unique.
Okay.
She's both a neuroscientist and a physiotherapist.
That's a pretty unusual combination.
Yeah, you don't see that very often.
I wonder if that unique perspective is what led her to focus on cerebral palsy.
It's possible. Her LinkedIn posts definitely suggest that she's very passionate about this area.
What'd she say?
She talks about the challenges families face in getting an early diagnosis and the importance of early intervention.
Makes sense. And it sounds like she's built a pretty impressive team.
Yeah, they describe themselves as collaborative and innovative, focused on making a real impact.
That's a good sign. A company culture that fosters collaboration
Definitely.
can often lead to breakthroughs, especially in a field as complex as healthcare.
Absolutely.
So let's talk about the ADA app itself.
Okay.
They claim it can provide a preliminary diagnosis of cerebral palsy just by analyzing a 3-minute video of a baby.
Yeah.
How does that even work?
Well, that's the million-dollar question, isn't it? Unfortunately, the sources don't go into great detail about the underlying technology,
Okay.
but we can assume it involves some form of computer vision AI,
Okay.
trained to recognize subtle movement patterns.
Movement patterns.
Yeah, that might indicate cerebral palsy.
It seems almost too good to be true, doesn't it? Just a 3-minute video and you have a diagnosis.
Yeah, it does seem that way.
Are there any potential downsides to getting a diagnosis so quickly?
Well, the biggest question is accuracy.
Accuracy.
Even if the app can identify potential signs of cerebral palsy,
Right?
it's crucial that those findings are confirmed by a medical professional.
Oh, absolutely.
You definitely wouldn't want parents to panic based on a preliminary assessment that turns out to be inaccurate.
Yeah. I can see how that could be really problematic.
Yeah.
Even if the diagnosis is accurate, wouldn't getting that news so early potentially be more stressful for parents?
It's certainly something to consider.
Yeah.
But on the other hand, early diagnosis can also give parents more time to prepare,
Okay.
access resources, and start early intervention therapies.
Right.
So it's a complex issue with potential benefits and drawbacks.
And what about access?
Yeah.
Will this app be available to everyone, or will it primarily benefit those who can afford it?
That's a great question, and one that Adapha doesn't address directly.
Good.
But it's a critical consideration, especially if they want to make a real impact on global healthcare.
Okay, so we've got this AI-powered app that could potentially diagnose cerebral palsy in just 3 minutes.
Potentially.
But Adapha is also working on something else, right?
Yeah.
The AIMS database.
Yes, the AIMS database is another AI-driven tool, but this one is designed for tracking the progression of multiple sclerosis.
So they're not just focused on infants.
It seems they're positioning themselves as leaders in AI-driven diagnostic tools
Okay.
across a range of conditions.
That's a really ambitious goal for a relatively new company.
It is, and it makes me wonder what their next move will be.
Yeah, like what other conditions might they target? What partnerships are they forming? There's a lot to keep an eye on here.
Absolutely. This is definitely a company to watch.
For now, let's shift gears and take a closer look at their world's first claim about the ADA app.
Okay.
If it's true, it could be a game changer.
It could be huge.
But what does that claim really mean? And what evidence do they have to back it up?
It's certainly a bold claim, and it's important to be a bit skeptical
Yeah.
when a company throws around phrases like world's first.
Right. Especially when there's so much hype around AI these days.
Exactly.
Everybody wants to be the first, the biggest, the most revolutionary.
Yeah. Right. So we need to look closely at what Adapha is actually claiming
Okay.
and how they're backing it up. The world's first statement seems to hinge on the fact that their app can provide a preliminary diagnosis of cerebral palsy
Right.
using AI and video analysis.
But are they truly the first to use AI for cerebral palsy diagnosis? I mean, there has to be other research in this area.
There definitely is. AI is being explored in various ways for diagnosing and managing cerebral palsy.
Right.
But Adapha's specific approach,
Okay.
using a short video of a baby's movements,
Yeah.
might be unique.
So the novelty might lie in the simplicity and accessibility of the method.
Potentially.
You don't need specialized equipment or lengthy examination.
Right.
Just a 3-minute video, a smartphone, and their app.
Yeah, potentially. But that raises another question.
Okay, what's that?
What kind of data did they use to train their AI for it to be reliable?
Okay.
It would need to be trained on a massive data set of videos
Right.
with a diverse range of babies, both with and without cerebral palsy.
And that data would need to be carefully annotated by medical professionals
Absolutely.
to ensure accuracy.
Yeah, that sounds like a pretty complex and resource-intensive process.
It definitely is, and it's something we need to consider when evaluating Adapha's claims.
Okay.
They haven't released any detailed information about their data sources or training methods, so it's difficult to assess the validity of their approach.
It makes you wonder if they're being a bit secretive about their technology
Yeah.
because they're worried about competition or because they haven't fully validated their claims yet.
It's hard to say for sure, but if they're serious about being recognized as a leader in this field,
Yeah,
they'll need to be more transparent about their methods
right.
and publish their research in peer-reviewed journals.
That makes sense. Without that level of scrutiny, it's hard for the medical community to take their claims seriously.
Exactly. And even if their technology is as groundbreaking as they say,
Okay.
there's still the question of how it will be implemented in real-world settings. Right? There's a big difference between developing an AI algorithm
Huge difference.
and actually integrating it into healthcare systems around the world.
Absolutely. Think about the regulatory hurdles,
Oh, yeah.
the potential for bias,
Right.
the need for ongoing training and education for healthcare professionals.
Oh, yeah, for sure.
It's a complex landscape to navigate.
It seems like Adapha has a lot to prove,
Do you?
both in terms of scientific rigor and practical implementation.
Absolutely.
But let's assume for a moment that they can overcome those challenges.
Okay.
What would the impact of this technology be if it really does work as advertised?
Well, the potential benefits are significant. Earlier diagnosis of cerebral palsy means earlier intervention, which can make a huge difference in a child's development and quality of life.
And imagine the impact in areas with limited access to specialized healthcare.
Right.
An app like this could potentially reach families who might otherwise go undiagnosed for years.
Exactly. It could democratize access to diagnosis and potentially lead to better outcomes for children all over the world.
But there are also potential risks, right? We talked about the possibility of false positives
Yes.
and the stress that could cause for families.
And there's also the concern about over-reliance on technology.
Yeah.
A preliminary diagnosis from an app should never replace a thorough evaluation
Right.
by a qualified medical professional.
It's important to remember that AI is a tool, not a replacement for human expertise.
Absolutely. And we need to be careful about not overselling the capabilities of AI. It's not a magic bullet, and it's crucial that we use it responsibly and ethically.
So even if Adapha's claims are valid, there's still a lot of complex questions to consider.
A lot of questions, yeah.
But let's shift gears a bit and talk about the company's broader ambitions.
Okay.
They're not just focused on cerebral palsy, right?
That's right. Their work with the AIMS database suggests they're interested in developing AI-powered diagnostic tools for other conditions as well.
And they're already publishing research and collaborating with established institutions.
They are.
It seems like they're trying to build a reputation as a leader in this emerging field.
They definitely are, but that raises another question.
Okay.
Can a small company in Samsun, Turkey, truly make a global impact on healthcare?
Yeah.
What kind of challenges might they face as they try to scale their operations and reach a wider audience?
Yeah, that's a good question. Scaling up is a major challenge for any startup, especially one operating in the complex and highly regulated world of healthcare.
Absolutely. They'll need significant resources.
Yeah.
Funding partnerships, a top-notch team to navigate those challenges effectively.
Let's start with funding. They've already secured some early investment, but will that be enough to fuel their global ambitions?
It's unlikely. Developing and deploying AI-powered diagnostic tools is an expensive undertaking.
Yeah.
They'll likely need to attract more substantial investments from venture capitalists or strategic partners.
And speaking of partners, they'll need to build strong relationships with key players in the healthcare ecosystem.
You're right. Hospitals, clinics, research institutions, regulatory bodies, these are all crucial stakeholders that they need to engage with.
Those partnerships could provide them with access to valuable data,
Absolutely.
clinical expertise, and distribution channels.
Exactly. And it's not just about securing those partnerships. It's about building trust and demonstrating their commitment to ethical practices
Right.
and patient safety.
Which brings us to another challenge, building a world-class team.
Yes.
They'll need to attract and retain top talent in AI software development, clinical research, and business development.
And that's not easy, especially for a company based outside of major tech hubs.
Right.
They'll need to offer competitive salaries, benefits, and a compelling work environment to attract the best and brightest.
It seems like they have a lot of hurdles to overcome if they want to achieve their goals.
They do.
But even if they manage to scale successfully, there's still a bigger question we need to consider.
And what's that?
The potential impact of this technology on society as a whole.
Mm-hmm.
Will it truly democratize access to healthcare, or will it create new forms of inequality?
That's a crucial question, and one that we need to grapple with as AI becomes increasingly integrated into our lives.
Yeah.
There's certainly the potential for good, earlier diagnosis, personalized treatment, improved outcomes.
Right.
But there are also risks we need to be mindful of.
Like what?
Well, there's the issue of affordability. If these AI-powered tools are only accessible to the wealthy,
Right.
they could exacerbate existing healthcare disparities.
And there's also the potential for bias, as we discussed earlier. If the algorithms are trained on biased data,
Yeah.
they could perpetuate or even amplify existing inequities.
Exactly. We need to be very careful about how we develop and deploy these technologies, ensuring that they are equitable, accessible, and beneficial to all members of society.
So Adapha's story is really just the beginning of a much larger conversation
It is.
about the role of AI in healthcare.
Absolutely. It's a story that highlights both the incredible potential of this technology and the profound responsibility that comes with it.
It's a story that challenges us to think critically about the future. We want to create a future where technology serves humanity rather than the other way around.
Adapha's journey is a reminder that innovation is not just about developing new technologies. It's about understanding their impact, navigating the ethical complexities, and ensuring that they are used to create a more just and equitable world.
And that's where our deep dive ends. But the conversation doesn't have to stop here. We encourage you to continue exploring these questions, to engage in thoughtful discussions, and to demand that technology is used for the betterment of all.
Because the future of healthcare, and indeed the future of our world, depends on it.